evening. Today we are going to discuss about materials and method. The consensus process incorporated a three-step modified Delphi method, which included meetings conducted in March 2020. The Delphi method is recommended for use in healthcare setting as a reliable means for determining consensus for a defined clinical problem. This method is an iterative process that uses a systematic scaling of consequent rounds of it. Modified Delphi is an effective process for determining expert group consensus where there is little or no definitive evidence and expert opinion playing a crucial role. So initially, a comprehensive list of questions was identified and consensus was built from the feedback provided by expert participants from the preceding rounds. The modified Delphi method consisted of 3 rounds of questions in a virtual meeting setting. The modified Delphi method was chosen because it allowed expert interaction in the final rounds. This allowed members of the panel to provide clarification on anemic problems and further debate to justify their viewpoints. Panel selection of 8 experts was taken since 5 to 10 experts are considered adequate for content validation. 8 experts in the field of gynecology, primarily menopause specialists, were initially contacted and asked to participate in consensus development. All 8 provided consent for participation via virtual meetings for consensus development. Therefore, experts were chosen to represent professional groups which directly influence patient care and would benefit from clinical practice guidelines. Since the goal of the study was to develop standards of care based on scientific information and medical advice, patients were not included as panel experts. Panel members were identified and selected based on their clinical and research expertise in the evaluation and treatment of patients with iron deficiency, anemia, and premenopausal age group. The panel consisted of endocrinologists and gynecologists. Once panel members were contacted and consent was obtained, the goals and the process of the